Hello, everybody. I'm just going to give a few more seconds for people to come in, and then we'll get started. All right. Good afternoon, everyone, and welcome to today's webinar, The Future of Workforce Management in Senior Care, Harnessing Technology to Meet Organizational Needs. My name is Kaylee Ann Mula, Member Services and Communications Coordinator with Advantage Ontario. I will now review some housekeeping items. All participants' line will be muted. However, you can participate by posting questions in the Q&A and chat box. If you are connecting via computer with speakers and a microphone, your audio is automatically connected. If you do not have any computer speakers, please dial in through your phone using the number on your screen or in the email that was provided to you. For any other questions, please submit it through the Q&A box, which you will find at the taskbar at the bottom of your screen. We also would like to mention that this webinar is being recorded and a link will be shared in this week's issue of Executive Report newsletter and posted in the members area of our website. Before we begin, we would like to recognize our corporate partners, Arjo and Complete Purchasing Services. I will now turn it over to our facilitator of the day, Chris Noon.
Okay, thank you, Kaylee, and hi, everyone. Thank you for joining us for today's webinar, which is a part of our Corporate Partners series. We thank our partners for offering our members with insightful, valued education for free. Today's session is supported by Complete Purchasing Services, and we're very pleased to welcome Paul Wright, CEO of GoEasyCare. With over 29 years of experience in telecommunications and workforce management, Paul brings a wealth of expertise in driving operational efficiency and innovation. And under his leadership, GoEasyCare has developed award-winning software that enhances workforce efficiency and improves care delivery. And so with that, I'll now turn it over to Paul so he can share some of his insights.
Great, thank you, Chris. Let me share my screen. All right, everyone, welcome to the webinar. And today, one second. My thing's set up here properly. So hello, everyone. So thank you for joining today's webinar. And as mentioned, I'm Paul Wright, CEO of GoEasyCare. So over the past decade, we've been helping healthcare and senior care facilities optimize their workforce management and tackling the challenges that come with it. So today we're going to be focusing on the key issues that organizations like yours are facing and how technology, including AI, can provide meaningful solutions. So the focus of the webinar is streamlining data management, so strategies to integrate all these systems and create seamless workflows. Improving employee health and wellness, so solutions that enhance the health and well-being of your employees. And the role of AI in workforce management, so how AI can unify systems, automate processes, and ultimately drive better outcomes. Since that is where the future is heading, it's a very important topic. So key challenges for HR and operations teams that we're currently facing. Data fragmentation. So managing multiple systems and inconsistent data across platforms. So your HRIS, your scheduling, time tracking, payroll, and various different systems could be LMS that are in your organization. It's very hard when the data is in different pockets. So all of these systems are managed by tools. So whether they're software applications, spreadsheets, paper, or some combination of, the more complicated and separated the tool, the greater the degradation of data. So we see this all the time in our implementation where not only is it a challenge when you have different types of systems and you're being asked to get results or reporting or some kind of deep dive into what your organization is up to, but even the tools themselves can be complex and hard to use. So we always use the adage that the person that is the best at using the software was probably there when the tool was implemented and they got fully trained. But as time moves on, as you know, people change different positions and move away from their, let's say, scheduling job. And the new person who comes in is never trained quite as well as the person that was there before. And what you see is a degradation of the use of the system, especially if it's complicated. And you'll end up in some kind of hybrid scenario. So even if you invest in some bigger, expensive tools, you can end up in a hybrid situation because people forget how to use the product anymore. And so they'll do some combination of spreadsheet and software. And so operational efficiency is really what we're looking for. So how do we reduce time-consuming administrative tasks and minimizing errors due to system and multiple inefficiencies? One of the themes you'll see we talk about as we're looking to bring these multiple systems together is the real power for information in your organization is in the data. So it's about getting at the data in a reasonable fashion. So as we look at the state of senior care industry, it's clear that the challenges we face are not only persistent, but growing in scale. So these issues directly impact workforce management, operational efficiency, and most importantly, care quality. So the role of technology can increase to get you back from the employee or get time back from the employees you already have. So workforce shortages, which I'm sure a lot of people are familiar with. So the senior care sector is projected to face a shortage of 199,000 healthcare workers by 2030. So that's exacerbating an already challenging staff environment and increasing reliance on overtime and temporary staff, which of course is increasing your costs. High turnover rates is another problem that raises its head. So long-term care facilities are facing huge turnover rates, creating instability in staffing and increasing recruitment and training costs. So the stat is 64% of healthcare workers cite burnout as a major factor in contributing to their rising turnover. So it's a very challenging job, as you know, and can be very tough on the employees. So rising labor costs. So frontline healthcare worker wages have increased 15 to 20% in the last 5 years, creating financial pressure on organizations that are already facing tight budgets and staffing shortages. So inefficiencies in workforce and time management, such as high overtime costs, account for nearly 10% of the total payroll expense in senior care. And when systems are disconnected, as we mentioned earlier, when you have silos of information, it's very difficult to introduce employee wellness efficiencies. So it's there, when you have employees logging into different systems, you got increasing regulatory complexity. So compliance requirements, rapidly evolving manual tracking systems are becoming increasingly inefficient, leading to a higher risk of non-compliance and penalties. %70 of healthcare organizations in Canada rely on multiple disconnected HR, scheduling, and payroll systems, making compliance, tracking, and reporting a significant challenge. So, and that, of course, leads to an impact on care quality. So understaffing and workforce management inefficiencies lead to decreased resident satisfaction and increased staff burnout, negatively affecting the overall quality of care. So it can be very much a challenge. So if you're struggling to get at the data in your organization, then your employees are also struggling to get the information that they need to be successful. Facilities using a full suite or all-in-one workforce management solution have seen a 30% reduction in absenteeism and improved workforce efficiency, helping to address some of these challenges. So this is really when we talk about a full suite or an all-in-one solution, this is where we take, instead of having a whole bunch of different systems, you can put them into one product, and that gives you full access to all the data that each of these individual silos are bringing to the table. So as we dive into the workforce challenges in healthcare and senior care, it's clear that these issues are deeply interconnected and growing more complex today. So today I'll share how that these challenges that affect care quality and operational efficiency, and how smarter technology solutions can help address them. So the key issues impacting senior care, so the need for smarter technology solutions. So AI-driven workforce management is just starting, and already it has been shown to reduce absenteeism by 30%, streamlining processes and improving workforce efficiency. So we all hear about AI this or AI that. So, where exactly are we in the coming AI machine learning revolution? Because we're all being told, oh, you can go on ChatGPT, you can, go to Gemini, you can write fancy letters, you can do different things. But really, where are we in the big picture? And why is it so important to have your data together? One of the things that people don't think about a whole lot is that what AI is really effective about is making sense of large bodies of data. So if you have your data in a whole bunch of different silos within your organization, it's very difficult for an AI tool to come in and really make a difference. If you make it accessible, all of your data accessible to AI tools, then you can really start to see some powerful changes. So where are we in this AI revolution? So I want you to think late 1800s. You're coming out of the general store and you see a horseless carriage go rambling up the street. This is really where we are. AI is just getting started, and we're really using just fancy, shiny tools, but the power and the capability of what's coming is going to be tremendous. And one of the stories I wanted to reference is how fast AI is changing, because it's unique to the industrial age where we saw the cars coming on the scene. Really, that was all about companies coming and building cars and getting the designs better, but it was people really building things. In the AI revolution, AI is going to be building AI. So it's going to get faster and faster and faster. And one example, just to let you know the pace of it, about a year and a half ago, I saw a demonstration of a virtual room that was created, and they were all characters in the room from history, like Genghis Khan and Washington and all these types of people. And so 5 of them were AI, and 1 of them was a human. And the challenge was for the AI to figure out who's the human and who are the other AIs. So by the end of the exercise, they really just asked, each one got a turn asking questions. And when they asked questions at the end of it, 4 of them were correct and 3 of them were wrong. So it wasn't that accurate. So fast forward a year and a half later, I saw a AI session with what they're now terming, you'll hear the term coming, called AI agents, which are AIs that are much smarter and can do things. And they called each other and talked to each other like just pretending to be 2 humans. It took about 10 seconds for both of them to detect that the other one was an AI agent, and they decided at that point to switch to binary because it was faster. So this whole thing is going to change very quickly, and the tools will get more and more powerful to really give your organization benefits. So integrating workforce data for smarter decision making. So, one of the problems that we see, is too many platforms, too little efficiency. So HR teams juggle 6 to 8 different tools, leading to inefficiencies in data silos. So example, your applicant tracking systems, your onboarding, your performance management, scheduling, shift filling, time tracking, payroll, LMS, and there's more. And so some of these could be in paper, some of these can be in Excel spreadsheets, some of these can be software. And you run into different challenges where one product might have good reporting and other doesn't have good reporting, and the manual processes don't have any. So it's very difficult to get the information out of your systems that you wish. 70% of HR professionals report difficulty in compiling accurate workforce data due to fragmented systems. So this is clearly the biggest challenge in a workforce world. time-consuming manual processes. So the lack of integration results in HR teams spending 40% more time on administration tasks like payroll, scheduling, and compliance. So not only are the systems not doing, what you need them to do, but they're causing your teams to spend so much time. So we talk about having to find new staff all the time. Well, you probably have a whole bunch of staff in the time that's being wasted trying to manage all the processes. And then along with that, of course, becomes increased risk of errors and compliance issues. So manual workloads, data transfers increase the risk of errors, leading to compliance violations and potential penalties. And employee frustration and engagement decline. So multiple logins, hard to use workforce management, and disconnected platforms reduce employee satisfaction and engagement. So we talk to an awful lot of different organizations, and it really differs on the challenge they have with their staff. And we have run across a couple of organizations that are, they don't even use staffing agencies. They actually have great employee engagement plans and great systems that keep the employees a lot more satisfied and happy and engaged. And they definitely get more work out of them, and they have less turnover and more participation from the workforce. So it can make a big difference. So industry trends that you're seeing come to light that are existing now and what's coming. So the shift towards automation in scheduling and payroll. So the automated workforce solutions can reduce scheduling errors by 96%, which is quite significant. AI-driven workforce management tools, so predictive analytics, improving staffing decisions and reducing last-minute changes. So these are the things that AI can dig deep, into your data and improve the different decisions that are being made, automatically hand out shifts, work with your employees, and do a lot of great automated stuff. So the role of predictive analytics in staffing decisions. So AI can reduce labor shortages by forecasting workforce needs months in advance. So this is one area that we are actually working on quite a bit, and we'll be talking about down at the Advantage Ontario conference in the AI Innovation Center. And think of an AI tool being able to proactively tell you that you have employees that are at risk of burnout, or that they're on the path heading towards a scenario that's going to be very challenging. And so if you could proactively approach your employees or proactively engage them into different roles, into different conversations to ward off any of those scenarios, and then you're going to end up with a much lower turnover rate. You're going to have employees that are engaged. You show that you're focusing on their health and wellness, making that really more productive and beneficial to the entire organization, because employees that are healthy and feeling good help other employees be healthy and feel good. So it's a much more positive environment, and AI is one of the great deep divers of information that can use the machine learning to do predictive analytics and take a look ahead at what's happening, and it can use it with trends that are in the past, so things that have occurred, and things it can look ahead and see what's going to be happening. So give you one example. So you start seeing a pattern of overtime being worked, or you start seeing a pattern of shifts dropping off. Maybe they're leaving early more often, or they're not working as much. You take a look at these patterns, and then you can mix them with things that are happening in the future. So I'm working lots of overtime, and we look ahead and see that there's no vacation booked, and there is time in the bank. So you can start taking a big holistic view of everything in your organization and start kind of, measuring up where is this employee on their risk factor for a burnout, or on their risk factor of just kind of not caring as much anymore, which can lead to your burnout and really just jump at a new job opportunity because they're they're disconnected. So there's lots of things that we can take a look at those patterns. So the growing importance of employee well-being and financial wellness. So 78% of employees say financial stress affects their job. So, as we know in today's world, there is a lot of individuals that are struggling financially. The cost of living has gone up, food, gas, you name it, everything has become more expensive. And, wages aren't necessarily keeping up with the growth of the costs. So this becomes a big factor. And, organizations should be looking at solutions that help employees in every aspect. So whether it's the health and wellness on the burnout scenario that I was just talking about, but for example, in this area when it comes to financial stress, one of the things that organizations are looking at is how can an employee proactively take some of their pay before payday. So for example, if I'm having trouble filling my car with a tank of gas, I'm not going to take a shift if it becomes available because I'm feeling stressed about spending the money to get there. So there are some great innovative tools that are coming specifically around the area. It's called EWA, which is early wage access. So these are tools that employees can individually sign up for themselves. So there's really no burden or there's no additional work done by the organization themselves. It's an opt-in scenario for the employee. And they can go ahead and let's say they need $50. They can take $50 ahead of time on wages they're earning and then get gas in their car, feel a little better. And they actually statistics show that employees who know they can get easier access to their wages are tend to work one more shift per pay period than if they didn't. So for all those employees that are struggling, this can be a very powerful tool that organizations can opt to put in and to use within their workplace as an employee health and wellness benefit. And there's a lot of neat things that you can do with that, but that's just one example of how you can help the employees, manage their individual lives better. So the power of technology in workforce management. So AI-powered scheduling and workforce planning, predicts staffing needs with 90% accuracy, ensuring the right coverage at the right time. So automated compliance monitoring. So reduce compliance violations by 70%, helping facilities stay audit ready, which I'm sure a lot of people have challenges around that. And things like intelligent recruitment and applicant tracking. So, in an ATS system or an applicant tracking system can cut your hiring time by 30%, streamlining the recruitment process. And this is, for example, a great place for an AI where the AI integrated into an applicant tracking system can write your job descriptions. So can not only write your job descriptions, it can actually do it in a really much better way than when we manually create them. And it's likely to attract more attention for the hires that you want to make. So if you're having trouble attracting talent, having really well-written job descriptions and job postings can be one of the keys that puts you over the top in getting actual hires over, the agencies that are trying or the facilities that are trying to hire as well. So that can be a very effective tool. Reducing administrative burden, so automated HR processes, reducing manual workload by 50%, freeing up time for better resident care. So a lot of these things, I don't think we stop enough to think about how much time they take, like the applicant tracking, doing job descriptions and job postings. This stuff can take a lot of time. The other area of that in the HR world is your onboarding. So once you have actually hired some applicants, then they need to be onboarded into your organization. So it's critical to get that right because you don't want to have a liability in the future that you have an employee that didn't sign one of your policies and is now in breach of said policy. That can be a problem in itself, but also all of your documents and your policies that need to be written and constantly kept up to date, or enhanced with the latest latest information that needs to be in them. These are things that AI can really help with today. So you can literally ask AI in an onboarding process, if it's engaged in the onboarding tool, write me a vacation policy, or a corporate vacation policy for our company. And here's the things, the main things we need in it, just a little brief description, and it will produce that document in seconds. So there's some really powerful things. And one of the very interesting things about AI is, as Ed mentioned earlier, that it works really well the larger the body of data. So a lot of the AI tools, I know we use Google Gemini in our company. And so we have the option where we can be creating emails, job postings, documents, policies, all these types of things. But if you have something that needs much more research, there's literally an option that just says deep research. So it will not only use, when you check that option, it will not only use, the data that it does have available to it, it will go out and search the internet. And it might take 3, 4, 5 hours to go do its research, but it will come back with a very well written, very well thought out deep dive on a subject or a document. And that's simply just click and go, just let it go do its thing. So there's so much that these tools can start doing for you that, if we think about it, we're already doing, but in a much more manual process with a lot of people involved. All right, so I think we're going to wrap up a little early actually today. We got through this a little faster than I thought. So before we wrap up, we want to hear from you. So we'll be running a few quick polling questions to gather your insights on workforce challenges and solutions in senior care. So your input will help shape the conversation moving forward. So we're going to be sending out some polls here and ask if you could please respond, and we can see the results and talk about them. So our first poll question: how many different systems are you currently using to manage HR, scheduling, and payroll? So, 1, 2 to 3, 4 to 5, or 6 or more. Give you a little time to do that. So at our next question, what has been the most effective strategy for keeping employees engaged in senior care? This would be for your organization. So competitive pay and benefits, career development opportunities, work-life balance and flexibility, recognition and appreciation programs. All right, the number 3. How can technology help create a more employee-friendly scheduling process? So automated shift filling and time off requests, providing mobile access for schedule updates, reducing manual scheduling errors, or all of the above. And last but not least, how do you see AI and automation shaping the future of scheduling and workforce planning in senior care? So it will streamline scheduling and reduce admin work. It will improve staffing decisions and forecasting. It will enhance employee work-life balance, or not sure yet. All right, so we got some polls. So interesting how, yeah, we've got some people using an all-in-one system. That's fantastic. And then we've got others for the first poll that are using 2 to 3 systems, which is the highest category. And then some are using 4 to 5. And thankfully, nobody's using 6 or more. But we can see this is pretty common to have multiple systems doing the job. So thank you for that feedback. The most effective strategy for keeping employees engaged in senior care. So it looks like the top 3: competitive pay and benefits, career development opportunities, work-life balance, and flexibility are the top 3 choices. And interestingly, the recognition and appreciation programs are lower than those 3. So that's interesting. And how can technology help create a more employee-friendly scheduling process? Select all that applies. So automated shift filling, providing mobile access, and reducing manual scheduling errors are all the same. And then all of the above. So I would agree that all 3 of those things can make a tangible difference in creating a more employee-friendly scheduling process. And for the question on AI, how you see AI and automation shaping the future of scheduling. So we'll streamline scheduling and reduce the admin work and improve staffing decisions and forecasting. We're both the same. And not sure yet. So interesting, nobody picked it. Will enhance employee work-life balance. So that's interesting. I would say that it's going to do a lot to enhance employee work-life balance, but let's see what the tools are as they come. But I think there's a lot of exciting things coming down the road that will actually dramatically enhance the experience and the employee work-life balance. So thank you to everyone for that.
Yeah, so thank you, Paul, for the presentation and the information. We do have some questions in the Q&A box, so I'll just read them to you and then you can reply.
Sure.
The first was, what steps can we do to ensure data consistency when different departments like HR, finance, admin are using different tools or systems?
Yeah, it's a challenge. So, with anything, when you're using different systems, the only way that you can really, try to keep control of that is process. You documented processes. This is how things work. This is what you have to do every single time. And then whether or not you have access to these different systems for reporting tools to try to bring it together is another question. It's a very difficult thing. But really, it's when you have different systems, because they operate differently, they look differently, you probably have separate logins. There's all kinds of things that go with that. It's very difficult to get any uniform process going. So you got to document. You got to make sure that everybody does the same thing all the time and records what needs to be recorded so you can try to stay on top of it. But that's part of the challenge in that multi data set environment.
Okay, great. For any members on the call that want to ask a question, you can just pop it into the Q&A box, and the box is just at the bottom of your screen. The next question is, sorry, it says, great presentation. We agree. What are some low-cost or scalable solutions for long-term care homes that may not have the resources to implement comprehensive software systems for HR or workforce management? And then there's a follow-up. It says, do you have any case studies of long-term care homes that are successfully reducing administrative burden through automation or the use of AI?
Yes. So yes to that last question. And so we'd be happy to get in touch and try to share some of that information. But when we're talking about, I'm not sure how, small is small in the long-term care facility, but what we found is that you need to find, so there are software tools available. So of all sizes of organizations, there's really there's really no magic bullet for a small system solution. I mean, really, the small system solution that people have tended to gone to is Excel, right? That's the advanced small system solution. So that's kind of one leap from paper to Excel. And so that can help, but it's still a lot of work, right? A lot of process. So we'd be happy to have a chat with that organization if they want to reach out to us, because there are tools that can be had at very reasonable price points that you can easily get your return on the value of it. So it may seem like there's this, we can't afford to spend this cost, but your return on that investment will be a lot bigger than the cost of the product itself.
Okay. How can people get in touch with you, Paul?
So they can reach out to GoEasyCare.com, or reach out to myself, even Paul W. at GoEasyCare.com, and we would be happy to connect with anyone and discuss this subject further.
Okay. The next question is, we have heard a lot of positive things about AI, but I'm curious to know if you know of any downside for having AI workforce management.
Yes, there are downsides. So it would be it would be foolish to think that we can't get ourselves into trouble here. But I can tell you the biggest rule of thumb, and I'll give you an example. So when somebody says, "Hey, go to ChatGPT and do your research, create your documents, do all that kind of stuff," I just let everybody know that if you are not on a enterprise type package, all of your data is being exposed to the world, and the ChatGPT license is free to do whatever with your information, whatever it wants. So that is a big high risk factor. So that would apply in the world of workforce management. If you are using a workforce management tool, let's say from a smaller organization that doesn't have pretty substantial infrastructure and controls in place, then the AI tools that they are using could easily be exposing your data out to the public domain, and you lose track of it, and could actually create a liability or a breach of your data services, and that's a serious problem. So, for example, in our world, we everything's enterprise, so that the data, the AI tool, we get access to all the tools, but the data never leaves the control of the enterprise environment to help keep your data secure and private. And that's the key. That's the biggest risk with AI today, is people don't understand the tools they're using are exposing their data all over the place.
Okay, great. So that looks like all the questions for today. I'll just mention to members on the call that at our upcoming convention at the end of next month, we're going to have an artificial intelligence showcase. And so we'll have 11 to 12 companies in that showcase showing their latest products, and are happy to talk to you further about AI and the use of AI in the industry. We're also going to have an ethicist coming to speak on artificial intelligence. That's one of our morning speakers, and she will actually be at the entrance of the AI showcase just to chat with people and connect with members and stuff. And Paul, I know your GoEasyCare will be in the showcase as well as other companies. And so you can find for members that are interested, you can go to advancingseniorcare.ca and get some more information on that. Paula has shared her contact info in the chat for those who want to connect with her. So she's got her phone number and her email, as well as a website and LinkedIn. You're very accessible, Paula. That's great. So yeah, if you do have any questions for Paul or Paula, you can reach out to them directly. So yeah, thank you, Paul. Thank you for your time and for sharing this information. And then to our Advantage Ontario members that are on the call, we do have more corporate partner webinars coming up this year, of course. You can visit advantageontario.ca, and we have the Learning tab. You can click on that and you can see the upcoming webinars. Our next webinar will be in the end of May, and it's going to be held by Arjo. We don't have the topic yet. We will have it posted soon, but you can find out more information there. Quick question just came in, more for me. Yes, for those on the call, we have recorded this presentation and we will be sharing the link with you. We also share the link in our member newsletter that goes out every Thursday. So if it's not in this week's, it'll be in next week's edition. But any member attending the call will get a copy of this of the recording. Okay. So again, thank you, Paul. Appreciate your time as always. And thank you to everyone for joining us this afternoon, and enjoy the rest of your day.
Great. Thank you, everyone.